Number 51. A 5-year-old girl had earache and some yellowish foul-smelling discharge, perforation at the attic, and conductive hearing loss. She has no past history of any ear infections. What is the most appropriate diagnosis? Option A, acute OM. Option B, OM with effusion. Option C, acquired cholesteatoma. Option D, congenital cholesteatoma. Option E, otitis externa. So these findings, presence of yellowish foul smelling discharge and hearing loss, conductive hearing loss, this is in congenital cholesteatoma. Question number 52. A female with type 1 diabetes mellitus would like to know about a deficiency of vitamins in pregnancy that can be harmful. A deficiency of which vitamin can lead to teratogenic effects in the child? Option A, folic acid. Option B, vitamin B12. Option C, thiamine. Option D, riboflavin. Option E, pyridoxine. So the correct option here is option A, folic acid. Question number 53. A 23-year-old woman has been having pain at the base of her thumb. The pain is reproduced when lifting her 3-month-old baby or changing diapers, and also with forceful abduction of the thumb against resistance. What is the likely cause? Option A, vascular necrosis of scaphoid. Option B, trigger finger. Option C, dequervens tenosynovitis. So the correct option here is option C, dequervens tenosynovitis. 54. A 6-month child presents with fever and cough. His mother has rushed him to the emergency department asking for help. Exam temperature is 39 degrees centigrade and the child is feeding poorly. Diagnosis is option A, bronchiolitis. Option B, asthma. Option C, bronchitis. So the correct option here is option A, bronchiolitis. A 75-year-old man collapsed while walking in his garden. He recovered fully within 30 minutes with blood pressure of 110 or 80 mm and regular pulse of 70 beats per minute. He has a systolic murmur on examination. His activities have been reduced lately, which he attributes to old age. What is the definitive diagnostic investigation that will assist you with his condition? Option A, ECG. Option B, echo. Option C, 24-hour ECG monitoring. Option D, 24-hour BP monitoring. Option E, previous CIN. So the correct option here is option B, echo. Question number 56. A 35-year-old man with a history of schizophrenia is brought to the ER by his friends due to drowsiness. On examination, he is generally rigid. A diagnosis of neuroleptic malignant syndrome, except option A, renal failure. Option B, pyrexia. Option C, elevated creatine kinase. Option D, usually occur after prolonged treatment. Option E, tachycardia. So the correct option here is option A, renal failure. 57. A 33-year-old drug addict wants to quit. She says she is ready to stop the drug abuse. She is supported by her friends and family. What drug treatment would you give her? Option A, benzodiazepines. Option B, diazepoxide. Option C, lithium. Option D, methadone. Option E, disulfiram. So the correct option here is option A, benzodiazepines. Question number 58. A 16-month child presents with drooling, sore throat, and loss of voice. He has fever with a temperature of 38.2 degrees centigrade. What is your next step towards management? Option A, direct pharyngoscopy. Option B, call ENT surgeon. Option C, call anesthesiologist. Option D, IV fluids. Option E, start antibiotics. So the correct option here is option C, call anesthesiologist. Number 59. A 62-year-old woman complains of unsteadiness when walking. On examination, she has pyramidal weakness of her left lower limb and reduced pain and temperature sensation on right leg and right side of trunk up to the umbilicus. Joint position sense is impaired at her left great toe but is normal elsewhere. She has definite left extensor plantar response and right plantar response is equivocal. Where is the lesion? Option A, left cervical cord. Option B, midline mid-thoracic cord. Option C, right mid-thoracic cord. Option D, left mid-thoracic cord. Option E, left lumbosacral plexus mid-thoracic cord. Question number 60. A 26-year-old man presents to emergency department with increasing shortness of breath on left side and chest pain. He has been a heavy smoker for the past 4 years. He doesn't have any past medical history. What is the likely diagnosis? Option A, pulmonary embolism. Option B, myocardial infarction. Option C, asthma. Option D, pleural effusion. Option E, pneumothorax. So age is 26-year-old and presence of shortness of breath and left side chest pain all indicates to pulmonary embolism. A 26-year-old man presents to ED with increasing shortness of breath on left side and chest pain. He has been a heavy smoker for the past 4 years. He doesn't have any past medical history. What is the likely diagnosis? Option A, pulmonary embolism. Option B, myocardial infarction. Option C, asthma. Option D, pleural effusion. Option E, pneumothorax.
The likely diagnosis is pneumothorax, given the patient's age, smoking history, and presentation of sudden shortness of breath and chest pain. ये सिर्फ याद दहानी के तौर पर है कि मैं तिब्बी मशवरा नहीं दे सकता।
Pneumothorax.
Pneumothorax is the presence of air in the pleural space between.
Question number 60. A 26-year-old man presents to emergency department with increasing shortness of breath on left side and chest pain. He has been a heavy smoker for the past 4 years. He doesn't have any past medical history. What is the likely diagnosis? Option A, pulmonary embolism. Option B, myocardial infarction. Option C, asthma. Option D, pleural effusion. Option E, pneumothorax. So the presence of increasing shortness of breath and heavy smoking history for past 4 years it indicates. So the correct option here is option E, pneumothorax. Question number 61. A patient with hepatocellular carcinoma has raised level of ferritin. What is the most probable cause? Option A, hemochromatosis. Option B, alpha-1 antitrypsin deficiency. Option C, cystic fibrosis. So the patient is with hepatocellular carcinoma and raised level of ferritin. So the probable cause is option A, hemochromatosis. Question number 62. A woman has electric pains in her face that start with jaw and move upwards. Her corneal reflexes are normal. What is the most likely diagnosis? Option A, atypical face pain. Option B, trigeminal neuralgia. Option C, temporomandibular joint dysfunction. Option D, JCA. Option E, herpes zoster. So the correct option here is option B, trigeminal neuralgia. Question number 63. A 32-year-old man presented with slow progressive dysphagia. There is past history of retrosternal discomfort and he has been treated with prokinetics and H2 blockers. What is the probable diagnosis? Option A, foreign body. Option B, Plummer-Vinson syndrome. Option C, pharyngeal pouch. Option D, peptic stricture. Option E, esophageal carcinoma. So the correct option here is option D, peptic stricture. Question number 64. A 56-year-old man comes with history of right-sided weakness and left-sided visual loss. Where is the occlusion? Option A, anterior meningeal artery. Option B, mid-meningeal artery. Option C, mid-cerebral artery. Option D, carotid artery. Option E, anterior cerebral artery. Option F, anterior communicating artery. Question number 64. A 56-year-old man comes with history of right-sided weakness and left-sided visual loss. Where is the occlusion? Option A, anterior meningeal artery. Option B, mid-meningeal artery. Option C, mid-cerebral artery. Option D, carotid artery. Option E, anterior cerebral artery. Option F, anterior communicating artery. Question number 64. A 56-year-old man comes with history of right-sided weakness and left-sided visual loss. Where is the occlusion? So the correct option here is option C, mid-cerebral artery. Question number 65. A young college student is found in his dorm unconscious. He has tachyarrhythmia and high fever. He also seems to be bleeding from his nose, which on examination shows a perforated nasal septum. What is the most likely diagnosis? Option A, marijuana OD, overdose. Option A, marijuana overdose. Option B, cocaine overdose. Option C, heroin overdose. Option D, alcohol overdose. Option E, carbon monoxide poisoning. So the correct option here is option C, heroin overdose. Number 66. A 56-year-old patient whose pain was relieved by oral morphine now presents with progressively worsening pain relieved by increasing the dose of oral morphine. However, the patient complains that the increased morphine makes him drowsy and he is unable to carry out his daily activities. What is the next step in his management? Option A, oral oxycodone. Option B, oral tramadol. Option C, PCA. Option D, IV fentanyl. Option E, diamorphine. So the correct option here is option A, oral oxycodone. Number 67. A 30-year-old man presents with a 5 cm neck mass anterior to the sternocleidomastoid muscle on the left side in its upper third. He states that the swelling has been treated with antibiotics for infection in the past. What is the most likely cause? Option A, branchial cyst. Option B, parotiditis. Option C, pharyngeal pouch. Option D, thyroglossal cyst. Option E, thyroid swelling. So the correct option here is option A, branchial cyst. Question number 68. An 18-year-old man is rushed into the ER by his friends, who left him immediately before they could be interviewed by staff. He is semi-conscious, respiratory rate is 8 per minute, blood pressure is 120 over 70 mmHg, pulse rate is 60 beats per minute. He is noted to have needle track marks on his arms and his pupils are small. What is the single best initial treatment? So the correct option here is option B, naloxone. Question number 69. A 30-year-old man and wife present to the reproductive endocrine clinic because of infertility. The man is tall, has bilateral gynecomastia. Examination of the testes revealed bilateral small firm testes. Which of the following investigation is most helpful in diagnosis? Option A, CT of pituitary. Option B, chromosomal analysis. Option C, measure of serum gonadotropins. Option D, measure of serum testosterone. So the correct option here is option B, chromosomal analysis. Question number 70. An 18-year-old female just received her A-level results and she didn't get into the university of her choice. She was brought into the ED after ingestion of 24 paracetamol tablets. Exam confused and tired. Initial management has been done. Investigation after 24-hour. Normal CBC, ABG, pH 7.1, PT 17 second, bilirubin 4 mol per liter, creatinine 83. What is the next step in the management? So option A is observation for another 24-hour. Option B, refer to psychologist. Option C, give an acetylcysteine. Option D, discharge with psychiatry referral. Option E, liver transplantation. So the correct option here is option E, liver transplantation. Question number 71. A 75-year-old alcoholic presents with a mass up to the umbilicus, urinary dribbling, incontinence, and cloth smelling of ammonia. What is the next step in the management? Option A, urethral catheter. Option B, suprapubic catheter. Option C, antibiotics. Option D, condom catheter. Option E, nephrostomy. So the correct option here is option A, urethral catheter. Question number 72. In chronic renal failure, main cause of vitamin D deficiency is the failure of option A, vitamin D absorption in intestines. Option B, 25 alpha hydroxylation of vitamin D. Option C, excess vitamin D loss in urine. Option D, 1 alpha hydroxylation of vitamin D. Option E, availability of vitamin D precursors. So the correct option here is option D, 1-alpha hydroxylation of vitamin D. Question number 73. Patient with puffiness of face and rash showing cotton wool spots on fundoscopy. What is the diagnosis? Option A, macular degeneration. Option B, hypertensive retinopathy. Option C, diabetic background. Option D, proliferative diabetic retinopathy. Option E, SLE. So the correct option here is option E, systemic lupus erythematosus or SLE. 74. A 35-year-old man presents with progressive breathlessness. He gave a history of polyarthralgia with painful lesion on the shin, CXR, bilateral hilar lymphadenopathy. What is the most likely diagnosis? Option A, bronchial asthma. Option B, cystic fibrosis. Option C, sarcoidosis. Option D, bronchiectasis. Option E, pneumonia. So the correct option here is option C, sarcoidosis. Number 75. A child presents with clean wound but has never been immunized as his parents were worried about it. There is no contraindication to immunization. What is the best management? Option A, full course of DTP. Option B, one single injection DT. Option C, one single injection DTP. Option D, only 1G. Option E, antibiotic. So the correct option is option B, one single injection DT. Question number 76. A 65-year-old hypertension man presents with lower abdominal pain and back pain. An expansive abdominal mass is palpated lateral and superior to the umbilicus. What is the single most discriminating investigation? Option A, laparoscopy. Option B, KUB X-ray. Option C, pelvic ultrasound. Option D, rectal exam. Option E, abdominal ultrasound. So the correct option here is option E, abdominal ultrasound. Question number 77. A 55-year-old man has had severe pain in the right hypochondrium for 24 hours. The pain comes in waves and is accompanied by nausea. Nothing seems to relieve the pain. He feels hot and sweaty but has normal temperature. What is the most appropriate next investigation? Option A, ultrasound abdomen. Option B, ERCP. Option C, MRCP. Option D, serum amylase. Option E, UGI endoscopy. So the correct option here is option A, ultrasound abdomen. Number 78. A 67-year-old man has deteriorating vision in his left eye. He has long-standing COPD and is on multiple drug therapy. What single medication is likely to cause this visual deterioration? Option A, B2 agonist. Option B, corticosteroid. Option C, diuretic. Option D, theophylline. So the correct option is option B, corticosteroid. Question number 79. A woman who returned from abroad after 3 weeks of holiday complains of severe diarrhea of 3 weeks. She also developed IDA and folic acid deficiency. What condition best describes her situation? Option A, jejunal villus atrophy. Option B, chronic diarrhea secretion. Option C, malabsorption. Option D, increased catabolism. Option E, increased secretion of acids. So correct option here is option C, malabsorption. Question number 80. A 35-year-old male is bitterly annoyed with people around him. He thinks that people are putting ideas into his head. What is the single most likely diagnosis? Option A, thought block. Option B, thought insertion. Option C, thought broadcasting. Option D, thought withdrawal. Option E, reference. So the correct option here is option B, thought insertion. Number 81. A 10-year-old girl presents with hoarseness of the voice. She is a known case of bronchial asthma and has been on oral steroids for a while. What is the most likely cause of hoarseness? Option A, laryngeal candidiasis. Option B, infective tonsillitis. Option C, laryngeal edema. Option D, allergic drug reaction. Option E, Ludwig's angina. So the correct option here is option A, laryngeal candidiasis. Question number 82. A lady with breast cancer has undergone axillary lymph node clearance. She develops arm swelling after being stung by a bee. What is the most likely mechanism responsible for the swelling? Option A, lymphedema. Option B, cellulitis. Option C, hypersensitivity reaction. Option D, DVT. Option E, fluid retention. So the correct option is option A, lymphedema. Question number 83. A 34-year-old patient presents with 50% partial thickness burns. What should be the most appropriate management? Option A, IV fluid calculated from the time of hospital arrival. Option B, IV fluids calculated from the time of burn. Option C, no IVF. Option D, IV dextrostat. Option E, burns ointment. Question number 83. A 34-year-old patient presents with 50% partial thickness burns. What should be the most appropriate management? Option A, IV fluids calculated from the time of hospital arrival. Option B, IV fluids calculated from the time of burn. Option C, no IVF. Option D, IV dextrostat. Option E, burns ointment. So the correct option is option B, IV fluids calculated from the time of burn. Question number 84. A 54-year-old man has recently been diagnosed with moderate depression. He has history of myocardial infarction and is suffering from insomnia. What is the drug of choice for him? Option A, citalopram. Option B, lofipramine. Option C is ECT. Option D, haloperidol. Option D, diazepam. So the correct option here is option A, citalopram. Question number 85. A man presented with cellulitis and swelling. He was started on flucloxacillin. What other medication do you want to add? Option A, vancomycin. Option B, penicillin. Option C, metronidazole. Option D, ceftriaxone. Option E, amoxicillin. So the correct option here is option C, metronidazole. Question number 86. A 24-year-old college student presents with nausea, vomiting, headache, neck stiffness, and a fever of 38.4 degrees centigrade. What is the most appropriate empirical antibiotic to be started? Option A, ceftriaxone. Option B, penicillin. Option C, gentamicin. Option D, tazobactam. Option E, meropenem. So the correct option is option A, ceftriaxone. Question number 87. A man with prosthetic heart valve underwent hemicolectomy and after some days complains of left hypochondriac pain, fever, and has systolic murmur. What is the next investigation to ascertain the cause of HF? Option A, CT. Option B, blood culture. Option C, ECG. Option D, MRI. Option E, radioactive thyroid scan. So the correct option is option B, blood culture. Question number 88. A 45-year-old man with posterior gastric ulcer presented with severe excruciating pain which subsided after conservative treatment. 10 days later, he developed swinging pyrexia. Ultrasound shows a collection in the peritoneum. What will be the most likely location of the collection? Option A, hepatorenal. Option B, left paracolic gutter. Option C, subpharynx. Option D, pelvic cavity. Option E, lesser sac. So the correct option is option C, subpharynx. Question number 89. A 23-year-old lady was prescribed with azithromycin 1 gram for her chlamydial pelvic infection. She has got a new boyfriend for the last 2 months. She has recently started contraception to avoid conception. Which of the following contraception method will be affected by azithromycin? Option A, barrier. Option B, IUCD. Option C, POP. Option D, COCP. So the correct option is option D, COCP. Question number 90. An 11-year-old boy is being checked by the diabetic specialist nurse. His HbA1c was high and he has been skipping meals recently. He has been unhappy at school. Which single member of the clinical team would you refer him to next? Option A, GP. Option B, pediatrician. Option C, dietitian. Option D, clinical psychologist. So the correct option is option D, clinical psychologist. Question number 91. A 35-year-old man who has served in the army present with lack of interest in enjoyable activities and feeling low. He doesn't feel like reading the news or watching movies as he believes there is violence everywhere. What is the most appropriate first line therapy? Option A, citalopram. Option B, lofipramine. Option C, CBT. Option D, chloride epoxide. Option E, desensitization. So the correct option is here is option A, citalopram. Question number 92. A man has reducible bulge below the pubic tubercle and on occlusion of the deep inguinal ring. Cough impulse is present. What is the most likely DX? Option A, direct inguinal. Option B, direct inguinal. Option A, direct inguinal. Option B, indirect inguinal. Option C, femoral. Option D, spigelian. So the correct option is option A, direct inguinal. Question number 93. A 48-year-old woman is admitted to emergency department with productive cough and moderate fever. She has often central chest pain and regurgitation of undigested food most times, but doesn't suffer from acid reflux. These symptoms have been present for the last 3.5 months, which affects both food and drink. A CXR shows an air fluid level behind a normal sized heart. What is the most likely diagnosis? Option A, pharyngeal pouch. Option B, hiatus hernium. Option C, bulbar palsy. Option D, achalasia. Option E, TB. So the correct option is option D, achalasia. Question number 94. A 64-year-old man has been waking up in the middle of the night to go to the bathroom. He also had difficulty in initiating micturition and complaints of dribbling. A diagnosis of BPH was made after a transrectal ultrasound guided biopsy, and patient was prepared for a TURP. What electrolyte abnormality is highly likely due to this surgery? Option A, hypokalemia. Option B, hypocalcemia. Option C, hyperkalemia. Option D, hyponatremia. Option E, hypernatremia. So the correct option here is option D, hyponatremia. Question number 95. A 56-year-old lady has developed severe right-sided headache which worsens whenever she comes to bright light. Since the last 4 days, she feels nauseated but doesn't vomit. What is the most likely diagnosis? Option A, subarachnoid hemorrhage. Option B, brain tumor. Option C, migraine. Option D, cluster headache. Option E, subdural headache. So the correct option here is option C, migraine. Number 96. A 35-year-old man presented with hematuria, abdominal swelling, and his blood pressure is 190 over 140. What is the most diagnostic investigation? Option A, cystoscopy. Option B, ultrasound. Option C, CT. Option D, renal biopsy. Option E, urine analysis. So the correct option here is option B, ultrasound. Question number 97. A young man is brought to the emergency department after an RTA. His GCS on initial evaluation is 6. What is the most appropriate next step? Option A, CT. Option B, MRI. Option C, IV fluids. Option D, skull X-ray. Option E, secure airway. So the correct option here is option E, secure airway. Question number 98. A 65-year-old man presented with frank hematuria. He has no other urinary symptoms. What is the most appropriate next step that will lead to the diagnosis? So the correct option here is option C, cystoscopy. Question number 99. A 30-year-old woman had gradual decrease of visual acuity since the last 3 years. Now she has a disability due to very low vision. What is the diagnosis? Option A, glaucoma. Option B, cataract. Option C, macular degeneration. Option D, retinitis pigmentosa. Option E, keratitis. So the correct option here is option B, cataract. Question number 100. A 27-year-old lady has had an uncomplicated pregnancy so far. She came to the hospital 2 hours ago after her water broke. The midwife is looking at her now. She has regular contractions. Per vaginal exam revealed 2 cm dilated cervix. Vital signs are normal. What stage of labor is she in? Option A, second stage. Option B, first stage. Option C, latent stage. Option D, third stage. Option E, active stage, active phase. So the correct option here is option B, first stage.